Good evening, everyone. Hopefully you are enjoying your dinner. This is catered by 36 Sweets, which is a Black-owned caterer. And hopefully you agree that this is an amazing, amazing meal and you all sleep well tonight. We're going to show you, or my name is Dr. Laura Espy Bell. I am the founder of Made for Medicine. And I'm so happy to have you here this evening to celebrate your children who are now my colleagues, that I affectionately call them doctor. What we're going to do is we created a video for this cohort. We do it for each of our cohorts just to show you a little bit of their personality, a little bit of what they want to be when they grow up, and hopefully it will show you their dedication to now entering a career as prestigious as medicine. And so I would like to thank Annie, who is our photographer, videographer, for putting this together, and her father, who are joining us tonight, for creating this video for you all to enjoy. It will be linked to our Columbus Medical Association website, so you'll be able to access on YouTube. And we can also share with you the link. So we're going to allow you to watch the video, and then we'll proceed with our program.
The program I love that everybody here is here to support you and love you through the process.
Okay, my name is Kayla Butcher, aka Dr. Butcher.
My name is Celeste Burks.
My name is Dr. Abdullah Bedora.
Michaela Poindexter.
Zane. Corey Anderson.
I am Trinity Stevenson.
Kellyanne. Celine Burks.
Ms. Judah Corley.
Josephine Joseph.
Dr. Mayana Brown.
Elijah Christos.
Rael Jackson.
Xander Dalton.
Claire Davidson.
I want to be a neurologist. I want to do the study of like seizures and stuff.
A brain surgeon.
I want to be a neuro-oncologist.
I would want to be a neurosurgeon, a trauma surgeon, or like an emergency medicine doctor.
I want to be a sports doctor.
A sports doctor.
Sports doctor.
I want to be a sports medicine doctor because I like to play sports and meet the top people.
Pediatrician and emergency medicine.
Some type of surgeon.
Right now, I'm thinking I might want to be a dermatologist.
A dermatologist.
I'm a surgeon, emergency medicine doctor, or a pediatric surgeon.
I want to be a veterinarian.
Veterinarian.
I can't really decide right now.
The favorite thing I learned was probably about I'm doing CPR.
I'd probably say emergency medicine. It was cool doing the CPR.
The CPR.
Probably the CPR.
Emergency medicine.
CPR.
I don't really know. I like it all.
I think my favorite thing was like seeing the heart.
Splinting.
I think I want to learn more about cardiology.
I want to learn more about the brain and kind of like ticks.
I really want to learn more about diabetes because I'm not personally affected by it, but I know a lot of people that are like in my school, in my classes.
How to do stitches and stuff like that.
I feel like maybe some more things have to do with skin and dermatology.
Learn more about like how to save lives. You know?
I'm really happy I came. Really, really happy. And I definitely, this was a really good thing.
So as you can see, our future is bright. Our future is very bright with all of the students that we've had in cohort 2. I'm personally very excited about all of the emergency medicine physicians that we have budding around here, because I am an emergency medicine physician, so I've had a little bit of influence on them. The white coat ceremony is a rite of passage and a journey toward a career of medicine. The white coat symbolizes professionalism, compassion, empathy, humanism, purpose, trust, excellence, and honor. The white coat represents a journey. Wear it with the understanding that this journey will be challenging, but it will be rewarding. Wear it with the understanding that it will be a sacrifice, but it is your calling. The professional satisfaction that you will get once you become a physician is one of the greatest gifts you will ever receive. Today, you will receive your first white coat. This is your introduction to your career in medicine. When you put it on, savor the moment. All too often, we don't take the time to truly take it all in. Pay attention to how it makes you feel and remember what it represents. When we cloak you with your white coat, take a breath, honor yourself, honor your family, honor your sacrifice to an upcoming career that is rooted in serving others. If the students would please line up in the back of the room so that we could honor you one by one, I would appreciate it. In this program, we address each other as doctor. I told them on the very first day of this program that we are claiming it and we are speaking it into existence right now. So when we call their names and they come forward, we will refer to them as such. If I could have our Made for Medicine faculty come forward. First, we have Dr. Abdella Abadora. Next, we have Dr. Corey Anderson. Next, we have Dr. Mayana Brown. Next we have Dr. Celeste Burks. Next, we have Dr. Celine Burks. Next, we have Dr. Kayla Butcher. Next we have Dr. Claire Davidson. Next, we have Dr. Zane Dalton. Next, we have Dr. Xander Dalton. Next, we have Dr. Josephine Joseph.
Next, we have Dr. Brielle Jackson. Next, we have Dr. Judah Corley. Next, we have Dr. Elijah Christos.
Man, there's the big picture. Look, her hair was like this. Okay. Long. Why don't you make it big like this?
You're on mute. Next, we have Dr. Michaela Poindexter.
Try and mute. Try mute. I don't know what's going on with this.
If we can hear you, maybe mute.
Next, we have Dr. Kaliani Russell. And last but not least, we have Dr. Trinity Stevenson.
Another round of applause for all of our amazing student doctors. Good feeling to see your child in a white coat, isn't it? It's a good feeling. This program would not be possible without the commitment and dedication of our Made for Medicine core faculty. The 8 faculty members that I chose for this program are very special people to me. Not only are they my colleagues, but some of my very, very good friends. The faculty members for the 2021-2022 year are as follows. Dr. BJ Hicks, vascular neurology. Dr. Reversa Joseph, neurology, movement disorders. Dr. Joshua Joseph, endocrinology. Dr. Kristen Brown, family medicine. Sorry, Kristen Johnson, family medicine. I got ahead, I'm sorry. Dr. Christopher Brown, who's not here today, is nephrology. Dr. Maureen Joyner, who was not able to make it today, is emergency medicine. Dr. Michelle Gola with pediatrics, and we have Dr. Jessica Motley with family medicine, sports medicine. We're growing. We have 3 new additional faculty members that are going to be joining our team in the fall. We will be having Dr. Dana Moulton with OBGYN, Dr. Lamont Clay with emergency medicine, and Dr. Victor Awar, who is a neurosurgeon, all of which are physicians of color. As you can see, these faculty members are all physicians of color. That was intentional, that was not by mistake. It was important for me to have Black faculty members teaching our students about medicine so that they could see themselves in us. It's important for me to choose physicians that are truly committed to serving our youth and giving back to our community, and faculty members that truly believe in my personal motto of lifting as you climb. They were all either born and raised right here in this community or have strong ties to the area. It is an honor and a privilege to recognize a few of our faculty members today. Every year we present them with a plaque or an award to honor them for their service to this program, because it's not an easy commitment. We were able to honor many of them during our first graduation, but today I'd like to honor Dr. Jessica Motley, who is a family physician and also with a focus in sports medicine, and is a resident at Ohio Health. Please come forward. Again, I am Dr. S.B. Bell, and I am emergency physician with Mid-Ohio Emergency Services, which is affiliated with Ohio Health, also the founder of Made for Medicine. And I must say that this program is everything to me. It has been a lifelong dream of mine to be able to give back to the next generation for a career that I love so much. I could not be more proud of the 16 students that completed cohort 2 for Made for Medicine, specifically because every week we had 100% participation in this cohort. Your children are brilliant. They're inquisitive, a little bit shy, I should say, overall for this cohort, but they were engaged, and I definitely can see them as physicians in years to come. I'd like to thank Dr. Falcone, who was here earlier. He is the CEO of the Columbus Medical Association, for helping me bring this vision to fruition. To Jasmine Green, who is here representing the foundation, for paying for this program. This is a free program for your children to participate in. I'd also like to thank E.C. Green, who is affiliated with the CMA, of course, Annie Wilson, our photographer, videographer extraordinaire, and BB Lagos for joining us this year and helping with all the planning and execution for the program. This program would not be possible without my amazing director, Dr. Erica Womack. She and I have been friends for many years, but she took my vision and she just executed it to a T. And she really is, I call her the real MVP. I always just like to personally and publicly thank you for everything that you do for me. Lastly, to my family, my mother, who has always been my compass, my sisters who keep me honest and keep me authentic, my children and my husband who support me in everything that I do. And I say that to say to my students, always remember your support system, because where you start and where you finish is on the shoulders of that support system. When we created this program, we created it to address the disparity of Black and/or African American physicians in this country. Only 7.3% of students enrolled in medical school in 2020 identified themselves as Black or African American. Approximately 5% of the nation's physicians are Black, and only 2% are Black women. As you can see, we're in dire need of a pipeline program such as Made for Medicine to change the statistics in the future. My hope is that in the next 10 years, that our students are on the forefront of medicine and are changing the face of what medicine looks like. So when you go to see your doctor, your primary care physician, your specialist, or when you deliver your baby, or when you have an emergency, or you have cancer, and you look at your oncologist, that you are able to go to a physician that looks like you. Studies have shown that physicians of color that treat patients of color have better outcomes. They have better experience in the hospital. They are advocated more. Their pain is controlled better. The purpose of this program was to expose students to careers in medicine. But not only that, we're here to support them in that journey. My faculty colleague members to my left will be the same faculty colleague members when your kids graduate from high school and go into college. And my hope is that we will always be that support system for your students as they continue down this long path to medicine. Every program session, I always say to them, what is our motto? Come on. What is our motto, Dr. Abadura? Dr. Davidson, what's our motto? Dr. Burks and Burks. Everyone. So that is a motto that we start off every session. If it is to be, it's up to me. This motto means a lot to me. My father, Ben Espy, started a program called the Columbus Youth Corps back in the 80s and 90s for students in Columbus to learn the value of hard work. So they would work in the summer, they would learn about professionalism, about work ethic, about showing up on time. And that was the motto of the program. And I said, well, that kind of applies to medicine. Because if it is to be, it's up to me in terms of the work that you have to put into it. These kids know this motto forward and backward. We say it all the time. And so my hope is that you continue to use this in your career of medicine as you continue down your path. The purpose of this program is to show them that they have exactly what it takes to become a physician. Because sometimes it's hard to see it when you're in the thick of it. As a child, my parents also always instilled in me the importance of education, of using my voice for good, of standing up for what I believe in, and always serving my community. I remember I was 11 years old, the same age as some of you, when I decided that I wanted to be a doctor. I was watching the Learning Channel, and I remember watching a cardiothoracic surgeon perform a 6-hour surgery on a patient. And I remember being so intrigued and fascinated by a human's ability to be able to use their hands to save the life of another. I remember thinking, how extraordinary is that? And I want to be that when I grow up. It was that moment at 11 years old that I knew what my passion was. From then forward, I immersed myself in medicine, anything I could possibly do, anything I could possibly learn. I shadowed doctors. I watched videos, TV shows about medicine. I even volunteered to work in an emergency department. I quickly learned that having the desire to do something was wonderful. However, the path to get there is not always straight and it's not always easy. Like any other kid, I was insecure growing up. Some of my grades were not as high as I would have liked. I wasn't always accepted in the crowds that I wanted to be in. There were bumps in the road. There were days where I felt like, you know what, I just do not have what it takes to be a doctor. I questioned whether or not I had the stamina or whether or not I was even smart enough to pursue it. In elementary school, I remember being bullied. In middle school, I remember a teacher telling me that I had too much of an opinion and I talked way too much. Can you imagine that? In high school, I remember struggling with math. And despite my best efforts, I just couldn't get there. I remember going to Spelman College and finding my voice and learning to honor my Black girl magic and finally being comfortable in my own skin. And then graduate school, making adult decisions and praying to God that I made the right ones. Medical school came the sleepless nights, the sacrifices away from the family, and praying to God, asking for the strength to get through. And then became the day as an emergency medicine attending physician. And that was a day when I realized it was all worth it. I say this to say that that day will one day come for you. When that one goal that you've always prayed for will finally come true. When everything falls into place and your perspective is clear and you finally reach that true north. When you finally realize that if it is to be, it's up to me. I'll share with you this story of when I realized that this was more about my journey and not about myself. I had a patient encounter that changed my life. It was my first month as an emergency medicine physician. 90-year-old African-American female, and I'm sorry if you've heard this story already. You have to hear it again. I walked in, what'd you say? Okay, good. I walked in to see her, and I always greet my patients when I walk in. I say, hi, I'm Dr. Esty Bell, nice to meet you. And she looked at me in amazement, and she says, you're the doctor? And I said, yes, ma'am, I'm the doctor gonna be the one taking care of you today. And with that same amazement came so much gratitude. She said to me, I've never seen a female doctor. And not only that, I've never seen an African-American doctor, and I'm 90 years old. So I talked with her a little bit about why she was there, but besides why she was coming into the emergency department, she wanted to know about me. She wanted to know where I went to high school, where I went to college, who was my mama, how many kids did I have? She wanted to know all of my life journey because she really wanted to get to know who I was. So we talked for a couple minutes. As I went to walk out of the room, I remember her telling me just how proud she was of me to be a doctor. And before I left, she said, I would really love for you to meet my family and to meet all my grandchildren. And, you know, as Black physicians, we get that a lot in terms of mentoring other students and students of color in the city. So I always say yes. I said, of course, I would be happy to. A couple hours went by, I went back to reassess her. And the nurse came and grabbed me and she said, Miss Jones in whatever room, she has some family here she wants you to meet. So I went in the room and she had all 14 of her grandchildren in the emergency department because she wanted them to see a real life doctor. Some of them were excited, other of them could care less, but it meant a lot to her for them to see a real Black physician doctor. So in that moment, it reminded me of the power of my voice, the power of my influence, and the power of my purpose. So when I go to work every day, when we go to work every day, we don't just represent ourselves. We represent our families. We represent our community. We represent so much more than just ourselves when we show up every day. Made for Medicine was created so that patients of color can be treated by physicians of color. We will no longer be the only ones in our physician lounges at work. We'll be no longer be the only ones in our physician practices, because in the future, we will have you right alongside with us. I understand that I was given the distinct privilege to work in a community where people of color can be treated by physicians that look like them, and we have never taken this for granted. I work primarily on the east side, and that was intentional because I grew up there. So it was important to me to come back to the same community that raised me. And my hope is that you all will too. Don't forget about Columbus. When you get to where you're going to be, make sure you come back and return and give back to others. So my advice for you as you enter your next phase, remember to show up every day. Show up with intention, show up with focus, show up with poise. You know, we talk about poise under pressure. Show up with power. You don't just represent yourself. Look at your table. You represent your family. You represent your grandparents. You represent all of our ancestors that have sacrificed our lives so that you could live your best life. You like that? That's what the young kids say. Allow God to use you for a purpose greater than yourself. Because if it is to be, don't ever forget that. Congratulations. We'll see you in phase 2. Thank you all so very much for coming tonight. We appreciate you dedicating your Friday night with the weather and the traffic to come here and support your children. As we move into phase 2, we will continue with the same faculty members. You will get correspondence about what that looks like. We will continue with small group sessions, so you'll get emails about different sessions that we'll host for your student to participate in. There will also be some maybe fun things over the summer for the students. My hope is that we create a community. I want these students to stay connected to each other. They may not have necessarily met each other if it were not be for this program. Just so we have students all over Columbus. So this is your village. These are the students that are going to support you when things get hard in academics and down that pathway. So we want you to stay with this community and know that this community supports and loves you. Feel free to contact any of the faculty members or myself with any questions. And please stay connected to the program. Congratulations.